Healthcare providers know that access to care poses a big problem for many people who need it. The issue is often transportation, but there can also be behavioral, financial, and psychological barriers that prevent patients from setting foot inside the walls of a hospital. The answer? Bringing needed medical care to communities, clinics, and neighborhoods that put it within reach of everyone. Welcome to Advancing Health, the podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. Sentara Health leaves no stone unturned in its quest to tackle the social determinants of health head-on and expand access to care in the communities it serves in thoughtful and creative ways. If you can't make it to the hospital services will come to you via neighborhood clinics, mobile vans, even a geographic information system that helps identify populations with the greatest needs and insufficient access to health care and community services. Joining me to share more about Sentara's formula for success is Iris Lundy, Vice President of Health Equity and a person with very deep ties to the community she is passionate about helping. Iris, thank you for joining me today on Advancing Health.
Thanks, Tom. Happy to be here.
Let me plunge right in. Among other things, you are a nurse, a mother, a grandmother, an Army veteran, and a colon cancer survivor. And I think all of those experiences have really helped you connect in different ways to families and communities and the healthcare system itself. So in terms of your personal journey, maybe you can share a little bit with our listeners about your passion to promote health equity within historically marginalized and rural communities.
Sure. For those who may not see us, I am a Black female. And when I think about just things that happen in our community and to me personally or to my family, it resonates, and it does. It makes me want to do more. Prior to my cancer diagnosis, I lost both of my parents to preventable diseases. And I have seen other family members suffer from things that in this day and age, we should not have to, based on education and just things that we could be helping to provide. So as for me, as a cancer survivor, my journey was a little, it didn't flow like someone would normally expect. I didn't just wake up and see bleeding and say, oh, this should happen. Nor was I at an age where I should be getting a colonoscopy yet. So for me, things happened a little bit differently. And when I was trying to explain to my then care team what was happening with me, it's as if they were not hearing me. And I am a nurse, as you said, and I'm sharing what I am experiencing, but they're going down a track, but they're never really hearing me. That's my perception of that. And so finally, I got with a physician. He says, I'm going to get you better. I am going to figure out what's happening with you. And he did. And he ordered a colonoscopy. And that's when it was determined I had colon cancer.
I see. The word that really leaps out of what you just said is preventable. You use that in reference to your parents passing and perhaps your own diagnosis. What is the prescription for that? How do you move the system in a way that preventable medical conditions are found sooner and acted upon sooner?
Yeah, I think we have to take the care where the people are. And we have to take and bring the educate people in a space that is physically and psychologically safe to them. Have a conversation about what is happening in our community. Hear what they're saying. Let's share with them the data we're seeing. And then let's share what we could do together to change some of this. And let people make an informed decision. I have found that to be so successful.
I think every hospital and health system leader that we ever talk to on this podcast has made the same point, that nobody does this alone. Everybody, to be successful, needs a community partner of some kind. So if you can take a minute to explain a little bit more about who Sentara works with in the Norfolk area and how you build those community partnerships that make such a difference.
Sure. I think one of the things you have to do is identify the voices in the community that are trusted by the community. That's very important. We have found that whether it's in the neighborhood, there's always an informal leader there. We work with those individuals. We work with certainly our health departments, other academic institutions, those kind of things. We certainly work with our HBCUs here. We have a medical school, we work with them, but we also work with organizations like NAACP, Urban League, and other community-based organizations such as the Food Bank, the YMCA. We do a lot of work with them. For mental wellness, there are community-based organizations that we work with also. We understand we need all of our partners coming to the table if we're going to truly impact and improve the health of our community.
And what are some of the specific tools that Sentara is using to do that, to bring access to care to the community where people are and meet them where they are?
Well, one, we went in and we talked to people and say, hey, tell us what you need. And as they're sharing what the need is and what's missing, and we're looking at data, then we began to take mobile RVs so that we could go at a time that was important to the community on days that are important to the community. If you're working 9 to 5, it's kind of hard to get in there. So sometimes we have to go on off hours or the weekends so that we can meet the needs of the community. How do we show up and meet people where they are? And then there are places where we have more traditional things, right? So we've actually put a clinic in one of our homeless shelters, but we've also put a clinic in the bottom of an apartment with wraparound services that are there so it's accessible to those who live in that community.
So much more convenient, we think, for people that otherwise would have a difficult time getting to the hospital or to a clinic that was downtown or far away or something. One thing I did want to ask about, and I mentioned this at the top, but I really would love some more information about it, is the use of the geographic information system technology to pinpoint and prioritize populations with the greatest needs. How does that work exactly?
I think geospatial mapping was a game changer for us. One, because you're able to visualize, you can share that data very quickly with whoever you're trying to talk to. So what we did was we put data, all types of data, right, in there so we could get a better picture. But we also looked at those social determinants, or we call them social drivers, in there also. We overlaid that. And if I wanted to look at chronic conditions, I could look at that. If I wanted to know where, I could slice the data any way I want to get a better picture. And then based on that, it could help me prioritize. So I'll give you an example. We were looking at breast cancer screenings, and we wanted to understand where did we need to educate and take our mobile mammo van. So when they did that for us, they could tell me who had not had a mammogram done in 2 or more years. It highlights up on my map, so it shows me where we should go for education, and then where we could take our mobile mammo van, to provide those services. We work very closely with the analytics IT team for that type of service, but we also work with our oncology service line for that. But more importantly, I think, is that we work with those community-based organizations. They host us at their sites, so that we can maximize and get the people there and get the word out that, hey, we're going to be here providing this particular service.
What an amazing and effective tool that is. And but the patients are de-identified in this system. You said you can slice and dice the data.
Absolutely. Yeah, we're able to protect privacy, but we can get down to the neighborhood level for us so that we can see that. If we were going to share it, you would not be able to tell who's living where.
I was thinking hospitals and health systems across the country are trying different things to move care beyond the four walls and into neighborhoods and clinics and reach people where they are. But in the end, I think, doesn't each individual have to decide for themselves how much time and effort they're willing to put into their own care? I mean, it's a decision every person, I think, has to, you either commit or you don't, or maybe you go halfway. But how do you persuade people in the end that they have to be co-partners in their own healthcare and work with Sentara and all the good things you're doing to make this happen?
I think honestly, it's not a lot of persuasion you have to do. I think part of it is that people did not have the access. And as you know, that is one of those determinants. And so if we provide access, if we make it easy for you to be able to do it, people are more likely to do it. It is hard to leave your job and understand you're going to miss hours of work when you feel okay. But if I say, we're going to pull up there and we only need you to step out for 15, 20 minutes, that's a game changer.
And if it involves a follow-up visit, if something is found, say, on an on-site clinic check, but you're invited to come into the hospital for further testing, are people willing to do that? Take that next step, follow up?
Absolutely. And I think it's because, again, we're providing wraparound services. So we have community health workers, they walk you through your process. So it's really not like you're left alone. You don't have to figure out how do you navigate a system. We're helping you with that piece.
That's phenomenal. You've got every important base covered, it sounds like. Where do you see your efforts going in the future? I mean, you've done so much so quickly and come so far. Where would you like to expand? What else would you like to do?
I would love to see, the landscape of medicine is changing, and we are seeing that, particularly when you're looking at cancers and other things that disparately impact Black and Brown and other historically marginalized or minoritized communities, we're seeing that things are increasing. So as things are increasing, us looking at that and being able to pivot to include that. The other thing is that what we may see on the horizon as a health system may look a little different than what the community sees.
Mhm.
So we have to make sure that we're fluid enough so that we're taking into account what the community has identified as important to them. Because if my blood pressure isn't bothering me, I may not find that as important, but the stress of not having a job or not having a livable wage, those things are important. So we're also coming along in that vein also to see how we help, right? Because we understand that it's more than just your medical health. We got to help with those other pieces also.
Based on your experience so far and Centara's experience as a health system and the things that you're trying to do, what advice would you give to your peers in the field who might be trying to do the same thing in their city or their neighborhood? What have you learned that you'd like to pass on?
I think one of the things that was most successful for us was going into the community and having very real and very raw conversations and listening to the community and coming back. So we have their qualitative data, their lived experience. We come back, we're looking at our data, all of the different points that we can pull together. And then it helps us paint a better picture of what is happening. And then going back to the community to say, here's what we heard from you. Here's what we're also seeing. Does this fit with your lived experience? And then how do we together move forward? Because I think if we can identify the common goal between the two of us, we can lay everything else aside and work toward that. And that has been very successful for us.
Quick follow-up on that. Sometimes I guess there has been a disconnect between what a care team might think a community is asking for, but then when you hear their voices and people say, no, what we really need is this, it may not fit with what the assumptions were starting out.
Absolutely. Absolutely. I mean, that does happen. We were working with a school system, and sometimes you think, well, this is the concern of the school. No, the school was very concerned about how do we make sure that when a child doesn't have clean uniforms, we can wash them and get something back on that child so that they feel, that we are treating them, the little person, with dignity, respect, and compassion. That was their most immediate need. We needed to make sure that we could address that need. And then we could have a larger conversation about, we understand that some children may start school late because they don't have their little child visit done or all of their immunizations. How do we partner with you and parents so that we can get children in school when they need to be?
Is there anything that I haven't asked about that you'd like to share in this podcast in terms of what you've learned or what you would like people to know about the whole effort to move healthcare into the community?
Tom, I think one of the things that we've learned is that there are a lot of things that come at people quite frequently and rapidly. And so how do we help them address those things? So when you're thinking about employment, thinking about food scarcity, some of those kind of things, and how do we break this cycle of poverty, right? How do we help people get to that next step in their journey? So we're doing that around scholarships. We have those kind of programs. So we work with schools. We're doing things so we can get young people interested in STEM programs. We're doing all kind of things so that we can prepare our communities to move forward. And we're doing this work with them, not for them. We are truly their neighbor.
It sounds like you're going so far beyond strictly medical health, in so many ways. And that seems to be the key to turn entire communities around. Well, thank you so much for your time and explaining some of the wonderful things that Sentara is doing in the Norfolk area, which I guess could be replicated pretty much anywhere if people have the resources and the mission drive to do it. Again, you have been hearing Iris Lundy, who is Vice President of Health Equity with Sentara Health, that's in Norfolk, Virginia, talking about the wonderful ways in which her organization is moving access to care beyond hospital walls and out into the communities that it serves. Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.